My name is Ray Comenzo. I'm a hematologist at Tufts Medical Center. And I'm going to talk a bit about one of our abstracts at the American Society of Hematology 2018 in San Diego, and also briefly give an overview of where things stand with systemic light chain amyloidosis, which is an area of my specialization. The abstract that we presented involves a trial called Seeking AL Amyloid Very Early, or SAVE. And the reason it's important is that we're trying to identify patients who have smoldering multiple myeloma, or MGUS, of the Lambda isotype, who also are at risk for AL amyloidosis. If they're not diagnosed early, they can progress to have heart and kidney damage that often makes it difficult for them to be treated. We've screened 21 patients. What we do is we send kits to patients all over the country. We have them go at a time when they're having their blood drawn to have 3 green top tubes drawn for us. We send them a small box, wrapping, and a shipping label, so it's at no cost to patients. They send the material back to us, and then we try to clone the gene that's causing their Lambda light chain disease, whether it's smoldering myeloma or MGUS, and assess the risk of having that gene with respect to light chain amyloidosis. We've identified one case of the 21 patients we've screened. That patient has gone on to be treated and is fine. She was more than well enough to be treated by the time that we diagnosed her. And it's really a trial that hopes to live up to its name, to save patients with smoldering myeloma and MGUS of the Lambda isotype from progressing to light chain amyloidosis. Let me say a few words about the current situation with respect to the treatment of light chain amyloidosis. The most important clinical trial that's open now is called the Andromeda trial. It's for newly diagnosed patients with light chain amyloidosis. They're randomized, like the flip of a coin, to receive either standard chemotherapy or standard chemotherapy with the addition of a very active monoclonal antibody called daratumumab. If you happen to know someone who's been diagnosed with light chain amyloidosis and needs to be treated, please put them in touch with a center that has Andromeda open. The centers are all over the United States, and there are many centers open in Western Europe as well. Unfortunately, 2018 brought to an end the treatments that were designed to get rid of amyloid in the body. 2 pharmaceutical companies, Prothena and GSK, GlaxoSmithKline, had attempted to develop treatments that would get rid of amyloid. However, in both instances, the treatments weren't as successful as folks had hoped for. So now there's one agent, KALE-101, that is coming into clinical trials with the hope of doing the same thing. So there's still hope for amyloid patients who have had treatments but still have some evidence of organ involvement with either the heart or the kidneys or the nervous system or liver. So that's a quick overview of SAVE, a quick overview of where we are with light chain amyloidosis. Our results today are better than they've been for many, many years. And there are many good doctors across the country, many associated with the IMF, who know how to treat amyloid. So if your friend or family member is diagnosed with that disease, please check out the doctors in your area.